Have you had hip pain in the past? You have it now. Let's talk about it. Let's talk about some other things that might be causing your hip pain that's not just your hip, okay? Especially if you're someone who's not getting a lot of relief, if you're really trying to treat your hip pain and you're really getting local treatment there, maybe by a physio, or you're working really hard at strengthening it and it's just not giving you what you want. Here are some things to think about. I'm an osteopathic manual practitioner, and we really think about what's going on in the front of the body, not just the muscles and the bones, and we think about the organs. Now, your large intestine sits right in a relationship in the front of your hips. So if you're someone who's had chronic digestive issues, or maybe you err on the side of constipation, or you maybe feel like you're a little inflamed in your digestive system, that is something that could be related to your hip. So next time you're experiencing some digestive discomfort, also be aware if the hip pain is increased. That's one way to kind of think if there's a bit of a relationship there. Another thing you can think about is bladder. Now your bladder sits right there in front of your pubic bone, right deep in your hip, in your pelvis, below your belly button, and the bladder can, again, the organs move around, and just like every other part of your body. And so you really want to think about, if I have a lot of bladder issues, maybe you leak, maybe you just had a baby and there's some issues going on and maybe your hip's hurting from that. I'm just getting you to think a little bit about outside the box and think about what is really in relationship to the front of your hip, which is your organs. So if you have any bladder issues, maybe you get pressure down there, maybe you get UTIs, you get infections often, something like that. You can think about that as maybe, oh, is that part of why my hip's not getting better? Again, something to think about. And if you've had multiple surgeries, so if you've had C-sections, or if you've had a hernia replacement or any other type of surgery, whether it's laparoscopic or not, then you really want to think, is that part of why I'm getting this hip pain? And again, I have lots of videos out there on how to help with scar tissue. Scar tissue is really important because you want to make sure it moves. Otherwise, it can create a really big anchor point that the body has to then figure out how to move around. Like I said, the body likes to move, and if parts of it aren't, due to big whacks or surgeries or scar tissue, all sorts of reasons, then it becomes more challenging for the body to heal itself. So we've got digestion, we've got you to think about your bladder, we've got you to think about if you've had multiple surgeries and you have scar tissue. And then another thing you can think about is where you're feeling the pain in your hip. If you're feeling it right at the front, you say, oh, the front of my hip is sore. That's generally, these are guidelines, you think it's more of a joint problem. If your hip is sore on the side, you can kind of wonder, is it bursitis? Is it a bursa issue? You maybe have heard of that. It's a little fluid-filled sac that's around every single one of our, well, not every single one, but around your hip joint. And as well, then you could have hip pain in your back, in the back of the hip, so in your glute, in your buttocks. And that would be more often known as pain coming from a nerve issue, likely sciatica. Again, these are guidelines. I'm not saying this is what you have at all. I'm just getting you to sort of open your mind, think about it. So front of the hip, we think more bone, joint, arthritic pain. Side of the hip, we think, could it be bursitis? And back of the hip, we think, let's just check all the tests to see if it's a sciatic issue. Okay. Again, the body is designed to heal itself. It really, really is. It's a magical, magical machine, isn't it? And if it's not, if you have hip pain, that's what we're talking about today, or any type of other pain, I just want you to sort of think outside of the box of like, my pain is the symptom is also the cause. So again, just because your hip might be sore doesn't mean that the cause of your hip pain is your hip. It could be, like I said, chronic digestive issues and the strain in that area, or it could be due to bladder stuff. And you can help that, and I'll get into that in different videos. But yes, I want you to think outside of the box. Don't just think, oh, I've got a pain here, the cause is here. Think, oh, there's all these other things connected. What could really be going on here? And I hope you found this valuable, and we'll see you next time and when we talk about your shoulders. Okay, bye-bye.